Welcome back to Cancer Buzz, the podcast of the Association of Community Cancer Centers. I'm your host, Summer Johnson. On today's mini episode, an award-winning program that uses a medical-legal partnership to address social determinants of health that have a remedy in civil law. Since 2011, the ACCC Innovator Awards have recognized the many creative and cost-effective solutions that ACCC member programs have implemented to deliver high-quality, patient-centered care in communities across the country. This show is the first in a series highlighting the 2022 ACCC Innovator Award-winning programs. Today, we're talking to Virginia Commonwealth University Health System, VCU Massey Cancer Center in Richmond, Virginia. Allison Held is Associate General Counsel and Director of VCU's Medical Legal Partnership, or MLP.
So I was serving on a nonprofit board called LINC, which stands for Legal Information Network for Cancer. And it was during that time that this nonprofit was providing free legal services to cancer patients in our community. And I read an article in the New York Times about medical legal partnerships. And I just thought the idea was brilliant because basically what medical legal partnerships are doing is putting these legal services, partnering with legal service organizations and offering those legal services on site in the hospital to low-income patients who have legal needs that affect their health and well-being. So at the time that I was serving on CancerLink's board, I approached another board member who was a high-level executive at Massey Cancer Center. And she and I talked about moving this organization into the hospital and forming a partnership so that we could eliminate those burdens for cancer patients, not having to pick up the phone and call when there are so many other things going on with a cancer diagnosis and treatment plan. And so we started the Medical Legal Partnership at Massey Cancer Center as an all-volunteer organization, and it just grew from there.
And what does the organization look like now?
We continue to have a partnership with CancerLink, is actually our legal partner at Massey, and CancerLink has a staff attorney that is dedicated to our program 24 hours a week. He works on site in the cancer center. We have a brand new adult outpatient pavilion, and we have office space that is right on the main floor across from the registration area. So he is available to meet with patients, with providers, with nurses, social workers about issues that are coming up with patients, legal issues that are rooted in kind of social problems for us to address. And we also have partnerships and programs that apply across the hospital. So not just for cancer patients. We serve 8 different patient populations. We have a number of lawyers that serve those populations, but CancerLink is our primary partner at Massey for those patients.
How are you educating the cancer care team to connect their patients with this service?
We do regular presentations with our providers to refresh their memory on, the kinds of services that we can provide to patients. And I will say that providing legal services as part of a hospital system is not core mission for a hospital. And especially when we were doing this more than 10 years ago, social determinants of health weren't universally recognized at that point. So convincing doctors that it was okay to have lawyers weren't roaming the halls, it was a little bit of a challenge, but as soon as we were able to improve outcomes for patients and we were able to demonstrate the value of the work that we did, our physicians, our social workers, our case managers quickly became our partners in this. And so we do regular education for our providers. We also do substantive primers. For example, we have one coming up on Medicaid eligibility, particularly for families who have mixed immigration status. We also educate on estate planning and talking about kind of the differences between wills, advanced medical directives, powers of attorney. And the way that we operate as a referral source, we are part of clinical workflow at Massey. So we have a web form that if you're an employee of VCU, it's on the intranet, and you go to the web form, you refer a patient to us in much the same way you would refer a patient to any subspecialty. And we have a case that's automatically created in our system in real time, and then we follow up with that patient directly. And so we are partnering with our providers. We often offer also curbside, we call them curbside consults. So providers will stop by, they might be having an issue with one patient or sometimes multiple patients getting medicine or something like that. And we can often address those issues with a provider without having to even provide that direct service to a patient.
Can you give us an example of the work that you've been doing?
In Richmond, unfortunately, and this may be happening across the country too, with pandemic, rental relief going away, we have a lot of evictions in the Richmond area. We're seeing an uptick in those, and we've had cancer patients who are being evicted or who are living in conditions that aren't conducive to good health. And we had a patient recently who also has a child with complex medical needs who did not have AC. The AC was not working in her apartment for a long time. Landlord was refusing to fix it. And so we were able to get her a window unit in the interim while we work with the landlord and get the landlord to comply with the law. But CancerLink is currently working with that family to get the AC unit installed and fixed in that unit.
Do you think this type of work adds to your own personal job satisfaction?
I have to say I'm inspired every day by the work of our physicians and our nurses and all of our healthcare team members that just constantly go above and beyond and working with patients on any number of issues that affect their health and their quality of life. And working for VCU and for Massey, it's a premier community-focused cancer center, and our director, Dr. Nguyen, is very committed to addressing health disparities in our community. And medical legal partnership is just one piece of that, one kind of tool in the toolbox to provide comprehensive, fully integrated care. And I love that mission and I love the work that we do. I find it deeply meaningful, and I consider myself very lucky to be able to do this for a living.
You can learn more about the MLP at the upcoming annual ACCC 39th National Oncology Conference, October 12th through the 14th in West Palm Beach. There's more information and a link to register in the show notes. Next week, an innovative program where primary care providers are embedded into the cancer service line. Until next time, for the Cancer Buzz team, this is Summer Johnson.
Cancer Buzz is a resource of the Association of Community Cancer Centers.